off. So Karen, you've been an osteopath quite a long time, so have I, and we thought we'd talk about walking and walking better for better health, because I think that's something that is topical at the moment, partly because of the lockdown and people trying to walk, but actually walking has got some inherent risk as well. Give me a little bit, I know you well, others may not, what your background in terms of, we're both osteopaths, but you were a dancer. Do you want to fill us in?
Started off my life as a ballet dancer. Most people grow out of that, but I decided to carry on and dance, and had a great time. And then I realized how important the body is, and it was fascinating, interesting, and so I retrained as an osteopath. So over the years, I have possibly used my dancing experience, and if we're talking of walking is something very easy we can all do, and like dance, you need to prepare your body for any sort of activity. So today we'll talk a little bit about warming up the feet and the lower legs and the body ready to walk.
Yeah, and in fact you were telling me the other day that when we were talking about this, that preparing the feet is something to do off weight bearing, so as in not actually whilst you're walking, but actually get things aligned. Do you want to explore that a little?
Yeah, I mean, you could anything to circle the feet, loosen up the bones, the many bones in the feet, about 26 I believe, and they're all articulating with each other. So if one of those joints is slightly caught up or restricted, and then you start doing a long walk on that, potentially you can strain a joint and get some sort of discomfort. So I always recommend anything that circles the feet one way, the other way, rising up when you're standing on your feet, working through the feet. You'll probably hear a few little clicks, and it should feel nice.
Okay, so it's to loosen up first, that's key. Because obviously with walking, even walking, people can get plantar sole of the foot pain. They can suffer from what they think might be what's called heel spurs, shin splints, and various pains. And the thing is, if you start walking badly to start with, as you get a little tired or get a little stiffer during the walk, you can start to go further and further, in a sense, walking more poorly, which means that actually your quality of walk gets reduced. And obviously you can start getting other pains in other places, in your hips or knees, higher up as well, or back. So yeah.
Certainly, I know, as you've worked a lot in sports clinics, injuries like running, also walking, similar things. If you're doing a repetitive motion, if there's something out of alignment, then that repetition can cause a problem.
Yeah, and also we were going to explore sort of what we've called mindful walking. So in other words, like you've been saying there, is becoming more body aware, using more of your body, but also thinking of where your feet are going as you're actually stepping, rather than just kind of not thinking about it. Should we explore that a little bit as well?
Yes, I think it's important that the alignment of your feet, you may notice your footprints are uneven, or as you walk, one knee bounces in or bounces out because of possibly a restriction in your hip or your back. So if you can mindfully observe how you walk, you can pick up something that may be potentially damaging. And if you consult an osteopath, they're very good at looking at you walking and picking up those little oddities that, if not corrected, can lead to a problem.
Yeah, I mean, some things you can walk off and you can work through, but that mindfulness, even without professional help at that point, is possible to actually kind of work things through. The other thing I think that's really important to talk about is the type of footwear people are choosing for their walks. So that's something we also have chatted over in the past as well. So what's in there, would you say, for people to bear in mind?
Well, you need to think of whether your foot is supported, whether it's loose in the shoe. If you can get blisters if you're wearing trainers, you want the laces comfortably tight so the foot is supported. A reasonable sole, you don't want a very thin soled shoe, otherwise you can, your body, you can get sore. Fasciitis can be caused by...
In the sole of the foot?
Yes, if the sole is too thin. So a good supportive shoe.
Yeah, I mean, obviously that's good advice in general terms, but in terms of doing up the shoe, a lot of people do wear their trainers semi-done up and not properly done up, and use them more like slippers, which really isn't doing the
No.
job in terms of supporting your foot. But obviously you can also look at the wear patterns under the sole of your foot, under the sole of the shoe, actually, and actually your foot, and see where there are pressure points on your foot, or the sole where it's become worn on the heel, or on where your foot or toe is striking. Because one of the facets or ways of walking is this what's called heel-toe motion. So talking that through, you've got that heel and then the toe. That's quite an important feature, as well as how people actually use their feet properly.
Yes, of course. When you're walking along, you swing your foot forwards, your heel hits the ground, and you roll through the heel, and then that foot that you've just stepped on then propels you forward. So there's a few things to think about, and as well for the mechanics, it's a mental exercise just to observe, be aware of that.
Sure. Okay. So consciously, again, looking at the footwear, getting the right quality footwear, and then using that foot. Obviously, when you get an arthritic toe, if you do, or you get pain in the big toe in different forms, there's a number of different things that people get big toe pain. That push off through the big toe becomes quite painful and difficult for some people to deal with. So cushioning the toe and foot can prevent that wear and tear and pain, and obviously keep that flow going through the way your foot is working. The other part of it is also walking with more of the whole of the body, not just thinking walking just your legs or your calves, shins and lower body. A little bit on that then, let's explore that.
Yes. Well, the hips obviously take, if you think of a professional walker, they have quite an exaggerated hip action, which rotates the spine, the lumbar spine, and then that carries on up the body, and you get the rotation in your arms. So if you're aware of that, arm forward, opposite leg forwards, there's a lovely rotation in the spine, which can articulate the spine. And the more you use the arms, the more you get a cardiovascular workout as well.
So you're making that walking better theme come out. Obviously, you're also going to work your abdominal muscles a bit more by doing that twisting, torsioning movement. So there's a number of benefits there to kind of working with the whole body. Some people even use walking poles, which kind of makes that point even more strongly, I think, to make them walk even better.
A sort of cross-trainer action. So joins in the exercise. So these are all things you could introduce to your walk to make it more challenging and more interesting.
And I think the other part, we talked about cardiovascular, that means obviously getting your heart and lungs engaged more actively. So obviously feeling that breathing, feeling the rib cage moving through that breathing, not resisting that. Because a lot of people, if they're sitting quite a lot, don't use their upper and lower ribs very much, actually, right up into their neck. So getting those arms moving and the breaths a bit deeper starts to engage the whole rib cage, and also the lower rib cage and back as well. So there's a lot of stuff going on if you actually start to use the body in that way. You need to build up. So we talked a bit, we haven't said a lot at this moment about warm-ups and warm-downs, but the warm-up stage, do you want to mention that just initially?
We've spoken about circling the feet, getting the feet ready.
Stretching beforehand might not be the best option, I think, is what we were saying.
We've found, science has found that the most effective way of stretching muscles is when the body is fully warm and has moved. So a stretch for your calf muscles after your exercise, possibly your thigh muscles. So before the exercise, just get a little bit of movement going, so your body has woken up.
Gently activating, gently getting things moving rather than pushing anything. So what we're saying is the stronger stretching or the more thorough stretching can be done after you've actually got the blood flow going and you've done your exercise. That's the warm down, in fact.
Definitely. And then hopefully you won't feel any muscle soreness the following day if you've only just started walking. That could be a problem. Or if you've been going up hills, if the terrain is different, then that can challenge some of the muscles you're using to walk. So stretching off would be possibly useful, usually to hold up to 20 to 30 seconds a muscle stretch.
Okay.
Should feel pleasant, never force into a painful stretch.
Exactly. And also, I think the other part about the variance in the course, apart from for mental health and well-being to get out and about and change the scenery, is to change and look at the terrain, because some of the things we're talking about here are getting people used to changing surfaces, you know, from something rougher like pebbles or stones or a flatter area of pavement, so that their body can adapt and accommodate without becoming unstable, really, or becoming painful, so that there could be a risk of falling. It's getting the body warmed up and getting used to that. So in terms of the incline or routes, it could be something people could do in terms of choosing different routes to plan that ahead.
Yes, maybe if you're walking every day, every other day, introduce a hill or introduce grass, which is possibly uneven, rather than just pavements.
Yeah, so a little bit of variety, really. Obviously, you can build up to that. But actually, I know I was treating a patient who I remember was telling me that they always turned right out of their front gate, and that was the direction they always went in. And it was interesting, that was the habit that had built up over quite a few years. And what was funny was that when we said, well, why not go left and do the route the other way round, so you got a different experience? And they actually did that. And it was kind of an obvious thing to say, but quite often those simple things, people fall into habits, and that's important to break those habits, to make variety for your body as well as your mind, to change things around a bit. It doesn't always come that easy. So just to finish up, also the apps. I mean, there's a lot of apps and so on. The Active 10 app, I'm not sure if you've seen that, but there's quite a useful app people use, which is Public Health England's app. It's free. And it's available to download on a smartphone. And I'm recommending it to everybody because it measures what's called brisk 10-minute pieces of exercise. That's why it's called Active 10. So yeah, just to try and get that cardiovascular system stimulated, because flat walking's fine to get warmed up, but obviously to get your system even more engaged, you need to stimulate it with a little bit more activity, which could be what's called brisk walks. So 10 minutes brisk, then you slow it down again, and then you revert again to the brisk walks. Ideally, about 30 minutes a day is a sort of benchmark idea. So, you know, that fits with, I think, everything we've been talking about in terms of walking and looking after yourself to make that walking better.
Yeah. And maybe to stop boredom, change stride out a little bit more, lift your knees a little bit,
Yes.
10 paces. Yes. And preferably not carrying anything. If you have to carry something, a rucksack, so that your arms are nice and free and can just follow the motion of your legs. Yeah. So
what we're saying, though, I mean, obviously shopping needs to be done and so on and so forth, but if you're going for a proper exercise walk, you don't want to have the imbalance of carrying on one side. No. Something on your back, like a backpack's better, but obviously carrying on one side is going to throw your body askew and not help that walk quality really as well. So some things like that to think about when you can. Yeah, I mean, I think that should be hopefully helpful to people, and do let us know if you want to know any more, I think it's fair to say. So Karen, thank you very much. We had a few people I know tuning in, and we lost the call slightly at the very beginning, which was a shame. But I think that's been really useful. So thank you, and I'll let you get back to work and seeing some patients. So have a good day.
Okay, thank you.
Thank you for tuning in, everyone.